Welcome, everyone. My name is Devin Price, and I am the host of the Talking Tech podcast. A little bit about me. I am a technology and cybersecurity professional who's been in the industry for a number of years. And during the day, I help organizations manage security risks. And during my career, since I've been in the space, tech and cybersecurity space for a little bit, I've had the pleasure of talking with other people who either have technology or cybersecurity aspirations, or those people who are already within the technology and cybersecurity fields doing great things. And at a certain point in time, I decided to create a platform to allow other people to listen in on previously private conversations that I would have had with those individuals. So if you're interested in being a future guest on the Talking Tech podcast, comment on this video and we can talk. So in this episode, I'm going to be talking with Dr. Erkeda DeRouen about what she's up to in the health tech space at this point in her career. So before Erkeda and I get into our conversation, I want to read you her bio just so everyone has an understanding of where she's coming from and the amazing things that she's already doing. So Dr. Erkeda DeRouen is a health technology consultant, health disparity disruptor, and triple board certified physician in family, diversity, and lifestyle, with a certificate in the business of medicine, who has a passion for merging the human aspect of medicine with innovation. She is licensed in 48 states and DC. She specializes in health tech consulting and executive coaching to help organizations thrive. She serves as a subject matter expert via her speaking engagements, podcasting, published book chapters, board leadership, and TEDx talks. She was also most recently named as a LinkedIn top public speaking, top healthcare management, and top working with physicians voice. Dr. Erkeda, I'll address you that one more time and then we'll just do Erkeda. Dr. Erkeda, welcome to the show. How are you feeling?
Thank you so much for that warm introduction. I'm feeling great. I appreciate you for inviting me on the show.
Of course. So let's get into it. I'm excited. So Erkeda, you're currently function now as a sought out consultant and thought leader in the space of health tech and innovation. But I want to go back to before you got into tech and innovation, why you decided to be or go into the medical field at all. Because being a doctor in any sense that generally is not something that people just do. Because of it, there's usually a reason. So when did you know you wanted to pursue a career in the healthcare field? Why did you decide to become a doctor?
That's a great question. And I think that it's different for everyone, especially who goes into medicine. Sometimes there are the people who may have a family member who impacted them or a personal life story in which they had a health condition and they wanted to go and help others. Or maybe they did a whole entire career and they were like, okay, I want to be a doctor now. For me, mine was a little more boring in terms of I did always want to be a doctor since I was a little girl. There are pictures of me being 2 years old with like the little doctor's kit, and they're like, "Is that the doctor's kit?" And I'm like, "No, I'm a doctor." But of course, children grow out of those things.
Yeah.
So with life, I've always been inquisitive. I'm very nosy.
Okay.
I want to know more and things like that. I'm very chatty. So I really wanted to merge my love of science and learning more with the people aspect of kind of talking to people and helping them navigate life. I did have some personal experiences throughout my childhood, which kind of pushed me a little further. When I was 3, I was hit by a car. I broke
Oh my goodness.
I had to learn to walk again. There are pictures with my little cast.
Oh no.
Yeah, so keep your kids in the yard, especially
yeah.
And then otherwise, my grandma, she had diabetes and things that go along with that. So I think out of me and my cousins and my grandpa and things that were in the house after school, I was the bravest one to try to give her her insulin injections and things like that.
Oh, I see.
It just grew over time, and I started to enter programs when I was in middle school and high school and continue.
Yeah, no, so that's there's a lot there. So number one, I think you said that you were nosy or inquisitive. Listen, if there's one professional that I interact with that I want to be nosy and inquisitive, it's my healthcare professional. There's no nook or cranny that if you find something or think something, I want to know. So I think you're in the right field for that. I think you did mention that you broken your leg. You said when you were 3. So you probably, I'm assuming you probably don't remember much of that.
No.
Okay. No, I was gonna ask if you were a little bit older. That probably would have been a way for you to like see that, I guess, healthcare patient process. But I think you got that. You said with your grandmother and just kind of giving her insulin, of just kind of being that, that bedside manner of just like, what is it like to care for somebody?
Mm-hmm.
And I think you also mentioned with diabetes. My grandfather actually, he passed away about 10 or 11 years ago. He actually had type 2. So that's about like all I knew. I didn't like ever see the insulin. I was too young at that point, but I did know he had that. One of the things I did want to follow up is, I understand now why you wanted to be a doctor, but why specifically family diversity and lifestyle? Because I don't know a whole lot about the medical field, but I do know that there are specializations.
Yes.
It's not just, hey, I want to be a doctor, but like, what do you want to specialize in?
Absolutely. I love to explain the process. And for me, as I was mentioning, I definitely love the people component and getting to
Right.
know people. And I'm sure for anyone who has interacted with the healthcare system, your primary care is kind of
Yep.
like your advocate, your person that's trying to go do everything for you. If you go to a surgeon, they might not even know your name.
Yeah.
So I knew that I wanted to build longitudinal relationships with patients. And that's how I kind of sought out primary care. I did not know if I wanted to be an internal medicine doctor, which is only sees adults, versus a family medicine doctor, which can see all lifespan from birth to death.
Right.
Or there's another type of doctor called med-peds that does internal medicine training, but also does kids. So I learned about that kind in medical school. So it was kind of going through the medical school process where you're doing the different rotations and stuff, and you kind of figure
Yep.
out what's for you. I knew that I wanted to do community medicine because grew up, most of my family is from DC, the inner
Yep.
city. It's a underserved population. So just looking from the lens of people who have resources versus not having resources, there's a big difference in the kind of care that they needed. So I kind of thought that I would be kind of like a hometown city doctor
Yeah.
for 30 years, and that would be it. So during the medical school process where I was trying to filter through the things, I had a rotation, which was strangely enough my OBGYN rotation. And I'll give you guys a spoiler, I do not like delivering babies. It's not my thing. In family medicine, you do have to have a certain requirement of training in that. So I delivered a lot of babies because I was a black clown. But outside of that, it wasn't my favorite, but the clinic aspect was where you're in there and you're talking about people and you're learning from them and stuff. So I had a rotation with an amazing doctor. I still remember her name, Dr. Michelle Sia. And she had the cutest little clinic because she would just talk about, like, let's have girl day. Let's have, and of course, they were all women in there.
Yeah.
So she picked a theme of the day. Like, I was there, and I'm dating myself, but when Prince William and Kate,
Yep.
I was on that rotation during then. So we're seeing the pictures in the magazine. So we're like, every lady that came in, we're like, what'd you think about the dress? So that was an icebreaker for women who had to get like their pap smears and things like that.
Wow, that is a great one.
So it was like bringing people together. So I wanted to be that kind of doctor. So throughout my training and things, and when I decided to go into residency and do that, that was kind of like my North Star. In addition to that, of course, advocating for the underserved, like I said, was kind of my basis. So I had done things like community service, and I was community service national chair for the Student National Medical Association and things like that. So just figuring out how to expand that. And then, so that's kind of my journey to family medicine.
Okay.
And that I'm sure we'll talk about how I got into tech and all of those things, but kind of the higher level perspective. Life is not linear.
Nope.
And you learn a lot of things throughout your process and your journey. So as time went on, I realized, yes, I am a primary care doctor, but they didn't teach me enough about how we're eating well and all of the preventative care that keeps people healthy and keeps them out of the hospital and out of the doctor's office. So that's when I decided to pursue lifestyle medicine to learn more about the 6 pillars of health and and all the things that I should be listening to, but I'm a hypocrite.
Yeah. Yeah.
But trying to learn more about that so I could support my patients and the family members and things that needed help. And from there, I also have become very active, of course, in the community and all of those kinds of things. So I wanted to search more, I think, especially after the George Floyd incidents, where I'm sure all of us at corporate jobs or whatever job you were at, if you were Black, you were kind of voluntold to sit in initiatives and stuff to improve diversity.
Right.
So, of course, serving the underserved has always been my mission. And of course, there's training and things like that for that. But I wanted something to back it up. I had also had a history when I was working in the community health clinics of working with populations that were underserved in terms of not having insurance. 50% of my patients were undocumented, uninsured, and then 50% of my patients were trans. So working with those communities as well also helped me to kind of push for advocacy. So I heard about diversity medical certification, board certification. So I decided to sit for it so that when I'm talking to organizations and trying to help them push the needle forward in terms of health equity, I would have the research and the experience and the certification to back up what I was saying and not just my lived experience.
Right. Wow. So that was great. I think you literally went through the family, the diversity, and the lifestyle as well. So yeah, this makes it very clear. One thing I will ask, so I grew up in Maryland. I grew up in the Prince George's County, Maryland. So I'm not a DC resident, never claimed this, but like I know the area. Like what part of DC did you grow up in?
So I grew up in PG County. So all my family
where?
In the city. But I'm a PG County girl. I went to Friendly High.
Yep, I know what it is. Yeah, I grew up in Bowie, not from Marlboro.
All right. Yes.
Okay. I had to ask that. Other thing I was going to say is, my sister's actually, she's a nurse practitioner. So some of what you said, that's kind of familiar, but I've learned much of like the medical process from her, but I'm still learning. After you basically made the decision to become a doctor, you graduated, you completed your undergrad, went to medical school at Boston University, and then you completed your residency at the University of Maryland, which now makes sense why that was. I saw that you spent a few years, just kind of sharpening your skills at Chase Brexton Healthcare in Maryland, which I did not know. I'm still learning about all the hospitals in Maryland. After that, I saw that you moved to a Seattle-based virtual care tech company called 98 Profit 6, where you operated first as a core physician, but then you moved all the way up to an associate medical director. And you were there doing some research. As I was doing some research, I saw that 98.6 was created in 2015 as one of the first companies to pioneer primary care using deep technology with the expertise of board certified physicians. So you were kind of coming in on like the cutting edge of, I guess, that pairing of, like you said, healthcare and innovation. Were you already aware when you joined the company of that, I guess, convergence between healthcare and technology? Or was that kind of like a new experience for you at the time?
That's a great question. And that kind of goes back to what I said in terms of life being a journey and learning from it.
Right.
So as you mentioned, I had worked at a community health center when I first transitioned from residency. And there I was growing as a physician, seeing my patient panels. I absolutely loved it. I loved my patients. But I was kind of struggling with the fact that with people who are underserved and kind of marginalized, you may know as a physician, like how to treat them. Like, oh, I know how to treat their diabetes. I know how to treat this. But if they don't have the resources, it's kind of like a struggle, and it kind of hurts to kind of watch them decline because they aren't getting the resources that they need. Yep. So I was dealing with that. And I mentioned a lot of that. I'm sure we'll discuss in my TEDx about that experience. But in addition to that, it was at a time when that organization was also unionizing. Mm-hmm. And it's kind of unheard of for providers to unionize. You kind of think of like residents or other organizations, but not necessarily physicians and other professionals. So with that, I kind of got voluntold to lead it. Oh. And from there, it was an 18-month process that I probably shouldn't go too much into what happened.
Sure,
But
sure.
we did a lot of negotiations, and it was a lot of leadership building, and I worked hand in hand with the amazing medical administration on the rights of like advocating for the staff and building the schedules and all of the administrative things that I found out that I actually love doing. So
Okay.
it's kind of my first kind of peek into strategy and kind of helping build up systems and things from a different perspective. So after that, I decided to look for another journey. So I was looking into other practices, and everything just seemed okay, but it like it was like the perfect Goldilocks fit for me. So I had heard about telemedicine, but I had never experienced it, and it was back in 2017, 2018 or so. So it was before it was cool. And
Right.
so
Yeah.
I decided to take a leap of faith after talking to a few people. And I actually was, I think, like the 7th or 8th doctor hired for that organization.
Wow.
And it was at a time where people were like, telemedicine isn't real, it's not going to last, and all of those things. So learned some things, and within 6 months, I was promoted into leadership.
Yeah.
And when you're in a startup, for those who may not be working in the startup environment, there is a lot of fast pace. There's a lot of hands-on, all hands on deck.
Yep.
There are no titles, like you're doing everything.
Yep.
So I learned a lot from that. And what I learned from that, of course, is managing larger teams, coming up with workflows, working to help with patient engagement, working to help with helping with onboarding and creating different things for employees and for your team, learning how to work and navigate hand in hand, because if you're not really sure, and for those who may not work in healthcare or health tech, we have like, of course, all the clinical teams and, the leadership teams, and you have the engineering and all of those, but some organizations, they work in silos, and we can't do that because medicine has a specific language and engineering has a different language and process.
Yes, it does.
Those things. So we have to figure out ways to merge that. So I was the clinician lead that kind of helped create a workflow where you kind of exchanged information and spoke the same language.
Oh, so you were the bridge.
Yeah, we'll call it that.
Okay.
So after that, I realized that I really did enjoy strategy and road mapping and development and working with tech teams. So I decided to transition. I had been doing some speaking on the side. I've been doing some consulting on the side, but nothing full time.
Right.
So I decided to dive into that, and I ended up transitioning into working for another startup called Alden, where they were focused on menopause telehealth. And from there, I was working to become their CMO. So I was doing all the CMO things, but startup life is fun, and it's an adventure, and it's unexpected. So within 4 months of me starting there, the company actually dissolved.
And so 98.6 was the next. Was that the next?
I had left 98.6 after I discovered that I wanted to do more consulting and build up teams more on a full-time basis.
Okay. No, that startup life, I think it always keeps you on your toes. And being from a startup myself, it helps you, make you more resourceful, more scrappy. And you get the opportunity, I think, to develop skills that, kind of like you said, that you may not have been able to do at that current point in time at a larger enterprise. So, I think the startup. Oh, go ahead.
Sorry, I was like, when you said that you may not be able to develop skills at the same level where we were, is very interesting, because when I talk to my friends and colleagues who may be more in traditional, we are not really early career, I guess, anymore when you're over a decade out.
Yeah.
But you're not senior.
Yeah. Yep.
So if you were working in a hospital, people are working to get their assistant faculty, and they're working to do this to eventually maybe get to chair before retirement. And it's such a fast pace in the tech world.
Yeah. No, it's very much the same. So I definitely don't regret working at the startup, but it's not it's not for everyone unless you're not prepared. While you were at, I know, we've already moved on from 98.6, but I did see that when you were at 98.6 as their medical director in 2020, that was a huge year for you, at least from what I can see. You got to inherit a podcast called the Prospective Doctor Podcast, which is still going, by the way. And last time I checked, had reached over 100 episodes. So congrats on that. How did that inheritance process take place? Who did you take over for? What made you say yes to that opportunity while you were already kind of learning new skills already at your day job?
I think 2020, like you said, was an interesting year for all of us. And I had a lot of time to myself and to think. And like I said, I love people. I'm chatty. I like going outside, those kinds of things that we couldn't really do in 2020. So I took that as an opportunity to connect in different ways. So I started being more engaging in certain online communities. I took to LinkedIn and I started having just virtual coffees with people without any expectations, just to get to learn about them and see what they're doing and how we could connect people, because at the core I feel as though I love being a human connector. So it became very interesting. So in one of the Facebook groups that I was in, one of the guys who actually was another podcaster for the organization that was looking for someone to replace, he put in a post and said, who loves medical education, would like to inspire students, those kinds of things. And I hurriedly raised my hand because I love mentorship.
Right.
I all of those kinds of things that I do in terms of academics and students. So I was looking for an opportunity to help out. So I told him I would love to learn more about the podcast and those things. So I ended up talking to their company, and Med School Coach is an organization that helps people figure out the admissions process for medical school, because it's a little competitive, as well as kind of help you for taking their MCAT, all those kinds of things. And they have several podcasts that kind of navigate them through that. So the Prospective Doctor's original purpose when it first came out before Erkeda was to just kind of talk through talk to different deans and people who are in the medical school to teach them how to get in.
Sure.
So I inherited it from a doctor called Renee, Dr. Renee, and she's awesome. But she was looking to transition into other things, but we didn't want the podcast to fail and not help it. So when I took it over, I wanted to kind of revamp what we were doing, because of course they need to know about admissions, but we also need to know about what's going on in current events in health, what is important, what types of foundations we want to learn about, like the lifestyle medicine, the wellness, the coaching, health equity, and how we can decrease bias in healthcare, and all of the things that we would want our graduates of healthcare to embody.
Correct.
So I started to invite different types of guests. And then, of course, since I'm a non-traditional physician, I wanted to also show people about the business of medicine, as well as things that other doctors who are doing, who may still practice, who may not practice anymore, are doing. So I brought in people who were venture capitalists, who started vans for people who were underserved to give them anesthesia, because there was a 2-year wait in Detroit to get anesthesia for kids for dental work. So they started a van. I've talked to people who have started their own institutions or started virtual reality medical education. So there was a wealth.
That sounds interesting.
Yeah, it was. There was a wealth of knowledge for the students out there, and it's just grown. So I think when I had done it, it maybe had been like 80 to 100 episodes, and now I think we're over 200. And every week we talk to someone who's amazing, and the students reach out and ask questions. So it's been great. I've even had some students who wrote in to ask to be on the show, and I've interviewed them. So it was a guy.
Oh, that's got to be fulfilling.
It was. So there was a guy who was studying for the medical school entrance exam called the MCAT.
Yep.
And he didn't have a lot of time because he was driving Uber, all of those kinds of things, trying to make ends meet. And he was listening to the podcast by one of my co-people that has another podcast teaching MCAT basics. And he, just by listening to it as he was like driving, he got a really great score. So
Wow. That's
he got his
awesome.
school, I think. So we talked
That's
about that.
awesome.
So it's just awesome that the team is helping people.
Wow, man, that's awesome. So yeah, that's great to hear. Like, obviously, Dr. Renee, founded the podcast and got it going. But it's great to hear that you kind of were able to put your own spin on it and really interject some new things. Essentially, from what I'm hearing you saying was like you wanted to arm, I guess, perspective, either people who are trying to get into medical school or people who are in medical school, and basically tell them about what are the health issues and um, tactics and practices that are going out in the field that you're going to have to learn.
Mm-hmm.
Yeah, I like that because especially with tech, that's one of the things with people who go to school for like a technology career is that what they learn is important, but there are medicine and I think healthcare and tech, they are constantly moving. So by the time anything you learn in school is probably 5 to 10 years old. So if you're not also getting something like the Perspective Doctor podcast was like, this is currently happening. There may be a little bit of like kind of a culture shock when these medical graduates, when they get out in the field and it's just like, what is all this? They didn't really, teach this in school as much. So it's great that you're providing that kind of current day, what's going on in healthcare. After, again, I said 2020 was kind of a big year for you. In addition to the Perspective Doctor podcast, you inheriting that 3 months after you started the podcast, you made the equally big decision to go into full-time business for yourself as Erkeda DeRouen, MD, LLC, which specializes in health tech organizations or helps health tech organizations accelerate growth with comprehensive solutions. So what made you decide to go into business, I guess, during that time of the podcast? Was that also you had time on your hands, or was there kind of a different reason?
I'm going to be fully transparent.
Sure, let's do it.
Turkey is interesting, as I mentioned, and I mentioned how I found out through my different roles that I discovered that I really love creating solutions to problems and helping think through the strategy and helping the roadmap and bringing people together and organizing teams. So through that, with my newfound time in 2020 and the virtual conversations that I were having through the virtual coffees and LinkedIn's, I had a lot of people starting to kind of message me and say, hey, can I pick your brain for this? Or hey, can I do this? And I genuinely love helping people. So people were picking my brain a lot. So
I can see where this is going.
And so I had to work on my boundaries and say, yes, I would love to have discussions, but out of respect to my paying clients, I cannot take on any uncompensated work, especially as a Black woman with these skill sets that is moving things forward. I think that it is unfair to make money off the backs of uncompensated workers.
Sure.
So I decided to start my own consultancy, and I help create digital solutions to improve patient outcomes for organizations, mostly in the telehealth space, but can also work with biotech companies and other things. Also hosting workshops to kind of help them talk about leadership and talk about other things in terms of what's going on in the health tech realm and in telehealth, talking about how we can improve these things with our organizations like benefits and how we can make them more equitable, because we know that all people don't need the same things in terms of benefits and health solutions and stuff. So I've been working to help people figure out how to optimize their workflows, how to create different processes, and how to work to incorporate that tech and utilize AI and utilize machine learning to help with efficiency and productivity, as well as structuring the teams in which they're the most beneficial.
Yeah. And I think one of the things you mentioned so you have the Erkeda DeRouen MD LLC, and within that, a subsidiary of that, you have your podcast and speaking engagements and a litany of other things that you do. One subsidiary is your health tech consultancy, called ELD Consultants.
Mm-hmm.
And with that, I think you kind of already answered what made you want to kind of go into health tech consultants or set up a consultancy. But my question is, if I am a prospective client who's interested in a health tech consultant, what can ELD consultants, offer me?
ELD consultants can offer whole-scale solutions. We can work with your clinical team to help them strategize and optimize their workflows. We can help them integrate and learn with machine learning in terms of how to incorporate guidelines that may not exist, of course, in the telehealth space, because all of the guidelines that hopefully your organization is following are kind of built for brick and mortar and in person. So we can help them transition them to say, okay, it gets to this point where you examine someone, we can't do that. How do you examine someone virtually? When
That's a good question.
where it would be like, okay, if you're in the clinic where I was and you're listening and you hear a murmur, I would send them to cardiology or something like that.
Right.
Okay. In the virtual setting, when it gets to this point, there's no guideline that says you send them in person because it should already be in person.
Correct.
So when you decide those things, what tests can you offer? What are the legal ramifications of different things? How do you re-stratify when to send someone somewhere? How can you do and work into the quality and make sure that they're still getting the standard of care and you're not overstepping boundaries? How can you work in the corporate practice of medicine collaboratively? Because there are certain legal things saying that like certain entities cannot own medical practices because it causes influence that it shouldn't. So physicians have to own the practices. So I have 49 licenses, which can help a company. So sometimes I can go into PC partnerships with them so that I can help them flow and optimize different things. We also talk about how to tastefully incorporate health equity into an organization because it's something that we're seeing, especially after George Floyd, where it was all highlighted, where there's so much bias in medicine. There are people, it doesn't matter what socioeconomic status you come from. We've seen like Serena Williams and Beyonce, like in their LP still having potential complications because of certain things. So how can we sit together and tastefully think through how to make things more equitable and not just throw things? I've talked with certain organizations who are like, okay, to be more equitable, should we just have Black people get a free credit? Or should we just offer, like, should we not ask race because then that's racist? And like thinking through things and helping people say like, okay, you have your blinders on. It's great that you're thinking about how to help certain marginalized groups, but we have to do better. So how can you think through it, think with research, not just throw things at them, and train people and optimize those flows? So that's what I help with.
Okay. No, that's great. I think one of the things I drew from that is, health equity and just these challenges that organizations face. It's not like a one size fits all. It's not like a, ready, set, go. It takes, there's a lot of complexities there. And that's why health tech consultancies are necessary. And that's, I'm assuming from what you're saying, that's the space that ELD consultants comes in to fill, correct?
Absolutely.
Got you. So we found out about your podcast that you currently have, your ELD health tech consultancy. Another of the things that looking at your profile I saw is that you are very much into working with other, various organizations, like you said. One of those organizations was Girl Develop It that you started working with, that's been around since 2020. And with Girl Develop It, for those that don't know, that's a national nonprofit organization that creates welcoming, supportive opportunities for women and non-binary adults to help them learn software development skills. And I think one of the things, Erkeda, that you've been saying is, for healthcare, it's, you can tell people, what they should do, but if they don't have the resources to make that happen, it's kind of all for naught. And I think also I like with technology that I can speak to is technology can offer a lot of underserved or minority communities a great way, I guess, to really change their kind of, financial, social, economic surroundings. But if there's no opportunity for them to learn, it's going to be difficult for them to tap into that. So I see that you are a current board member of Girl Develop It. Why? I guess, can you tell me a little bit about what GDI is working on, and in how are they basically working to diversify tech for women and non-binary adults? Like, what are some of the initiatives they've been working on so far this year?
Girl Develop It is so close to my heart because, as you mentioned, they're working really hard to open the doors and allow women and non-binary people to explore tech, advance their careers, regardless of what situation they are in. If they're in college, if they are coming back for a second career, if they're looking for something else to change. Initially, like Girl Development has been around for a while, it's a little over a decade, and they were more based in person with colleges because it was
Right.
an in-person organization. But I think the pandemic actually helped GDI because they were able to take a step back and to think about how we can expand and be more inclusive. So when I joined the board about 3 years ago, we
Mm-hmm.
also were in a state of transition where half the board was new and our executive director had just been hired about 3 months before. So we were able to sit and kind of think through this, especially during the pandemic, and say, okay, we've been thrown this conundrum. We have an in-person organization to help women and they're not in school. they're at home. It's the pandemic. So how can we still reach people and help them grow? So we did a whole revamp. We talked more about how to create things that are more equitable. We talked about more resources. We've had online revisions and courses and all of these different workshops and things. And I think that it's actually impacted more. We have more users every month. It's going up. We have success stories where women are talking about how they came in, they learned their skills, they got this job. We have career
Yes.
fairs, we have lunch and learns and things where they can network. So it's been very helpful. We even have one graduate who was recently in our program, I think, that went and created her own startup. And I think she's raised
Oh,
like
nice.
$2 million or something, like from the
Whoa.
things that she learned at GDI. So I think I'm going to interview her soon. And
Nice.
we're doing things like hackathons. So last year we had our second hackathon, or maybe our first, where we were able to focus on healthcare tech. So we had all of the people come together and think of health solutions, and some people went forward after that. This year we're going to have another hackathon, I think the first week in November, and we have so many people who are registered, I think a few hundred, and they're going to come together virtually, be able to work in their groups with their skill sets, as well as talk to different organizations and our sponsors in order to help them figure out how they can advance their career.
Wow, that's great. I love. Again, you continue to see. I guess the organizations and people that you invest in. It always seems to continue to come back around with the person that you helped with the in medical school as he was driving around his Uber, and now this woman that was able to do a bang up job with her startup. Uh, One of the things, Erkeda, that I really want to make sure that we have a chance to talk about is you actually mentioned, um, in addition to podcasting and having your own consultancy, you've actually gotten to do a number of speaking engagements. But the one I really want to talk about is the opportunity you had in 2022 at TEDx DeSoto, which is in Texas, I believe. For those people, I had to look that up. Um, that was an opportunity that you got. You've gotten a chance to speak, at White House for Black History Month, MIT, ABC, but TEDx is the one I really want to go to. And your talk that you were able to speak about was titled "Did Disney Just Save Healthcare? Imagine This." And during that TEDx, you mentioned how the rise of telemedicine was, supposed to break down all these barriers for health equity, but because of subject matter experts still, working in silos like we talked about before, that, I guess, added benefit hasn't yet materialized. So first off, with the TEDx, how did that opportunity come about? Did you reach out to them? Did you submit your talk, or did they just kind of reach out to you based on what you were doing within the healthcare equity and tech innovation space?
So there are several ways to do a TEDx. A lot of people love to ask about this. Originally, when I was very into TEDx's and things like that, watching the little TED Talks, Brene Brown and all of that. But I was like, okay, maybe 1 year I'll do one.
Mm-hmm.
And when 2020 hit, that was something else I was thinking about. So I applied, like they have applications that come out. I applied to like one or two, and I was like, whatever. But then when I had more time, I started thinking about it more realistically and what message and what idea did I want to get out. So I had gone in one of those Facebook groups, and they had someone announcing that they had a TEDx coach that was going to talk through how to do things. Cesar Cervantes, and he's amazing. So I met with his organization and his group and listened to them, and they kind of taught me how to structure my application. So on my first application, I was accepted. So I was like,
Wow.
it seems like that usually doesn't happen. And I was like, oh, I guess my words were needed to be reorganized. So it was really amazing because it was the first one done in TEDx in DeSoto, and it was the first one in the metaverse. And we just had a really good group of people talking about ideas that I think can change the world. So there are, as I was mentioning, different ways. So as I was mentioning, I did the application route.
Okay.
There are some people who do get invited. So after my TEDx, a few months later, another TEDx had reached out to me because they had saw things and asked me to speak at theirs, but there was a scheduling conflict. So some people are invited. And then there are some where some people act as organizers and things like that. So I would just start, if you're interested in exploring TEDx, with starting by exploring their website, because they usually list all of the upcoming TEDx's and their applications online. And if you want to talk with someone to talk through it, you can definitely reach out to Caesar or some other person out there.
I'm learning a lot from this conversation, Erkeda, but definitely number one is I got to check my Facebook. Apparently, podcast opportunities, TEDx. I've got to check my messages. Getting back to,
It's for old people, but I said, okay.
listen, if a lot's happening based on what's happening with you. But going back to your TEDx talk, you were saying in that talk that in order to truly innovate healthcare, we need to learn from Disney and their structure of basically having Imagineers, or bringing in professionals from different and diverse fields to kind of come up with, I guess in Disney's chance, a better way of making their company or making a film. Having diverse mindsets is going to create the best product. And for you, you were saying that, hey, healthcare and healthcare innovation, we need to basically kind of co-opt Disney's Imagineers and put a healthcare spin on it. The word you used was pacemakers. And your definition for those pacemakers was those people who can set the pace of healthcare innovation. So most recently, I'm assuming as a result of your TEDx talk, you started the Pace Makerz organization, which has the mission of reducing health disparities by addressing the social determinants of health through education, community building, and advocacy. And you also presented in August of this year at the Black is Tech 2023 conference, and your conversation there, or your speech, that was also titled Rebuilding Healthcare, Creating Technology to Improve Healthcare for All. I'm assuming that was also kind of more or less, I guess, I'm sure there were additions, but that talk, I'm assuming, was heavily based on the TEDx. Is that correct? Or was there a different spin?
So it wasn't a talk for the Black is Tech.
Mm-hmm.
It was a panel of health
I
leaders
see.
that we discussed how each of our organizations were impacted in building a more tech-enabled future for equity.
Got you. I still need to make the Black is Tech go to one myself, but no, so I was not familiar. So one of the things based on that topic, rebuilding healthcare, creating technology to improve healthcare for all, is I was wondering, I know you've talked a little bit, is how, about these topics throughout our conversation, is how do you foresee emerging technology, AI, metaverse, telemedicine, how do you see that playing a role in improving healthcare, for all moving forward? I guess more or less, what are your thoughts on, I would call it telemedicine 2.0?
I think there's so much hope. It's very exciting because number one, with technology, there's more access.
Yeah.
And not saying that we don't have access in certain communities and things, but how do we utilize it? What are we utilizing? How are we reaching people? We're even seeing that now in terms of health education, how if you go to the doctor, they'll give you a printout after visit summary, it goes in the trash.
Right,
It's
right,
not
right.
going through what people are doing and connecting with people. What we noticed, especially during the spike in the pandemic, is a lot of professionals had more time to spread health information that is evidence-based, TikTok, on Instagram, and all of those different places. And they've been able to encourage people and kind of counter the false or misinformation that's out there. So how can we tag that up a notch is very important. How can we innovate in spaces where we are found and where we're living? So have been some pilots where people have gone to barbershops with iPads and talked to them and kind of got them, did their blood pressure there, or gave
Oh,
them a set, or taught the barbers how to do it and tutored them. So while you're
that's a
sitting
good
there,
idea.
you come over and they're checking your blood pressure. Oh man, that's a little high. You want to sign up for this free app?
That's a
That
good
kind of thing.
idea.
How can you reach people where they are? How
Yeah.
can you educate them on how to navigate the system? Is very important. And then how can we utilize this technology? Like we mentioned, the panel on Black is Tech. I had a wonderful Dr. Arbery Grant, who came on my show recently. We connected and we followed up. And he is number one, the cardiologist for the Redskins and the Ravens, but he also works to decrease bias for
Mm.
organizations. So he incorporates with PR. He has them go and they do like their diversity trainings on there, and it's shown it
Oh,
in adherence and an impact on these organizations. So how are we merging tech with the everyday mundane things that people are doing and bringing it to them where they are and kind of bringing that awareness? So I think that there's so much hope with telemedicine, with all of the different things, even with us reaching out for things like clinical trials. A lot of people who are marginalized historically do not go and participate in that, but then we don't have
yes.
the evidence and the research to help create medicines that are more geared towards us. So
Right.
there's medications like blood pressure medicines and depression medicines and things like that that kind of go off of your biomarkers and could help you a little more. But how do we encourage people to get there? How do we educate them, and how do we utilize the technology to make it easier for them? So it's a really exciting time.
Yeah. No, that barbershop idea is genius. Because I mean, yeah, you're just sitting there.
Why
I
not
might
bring
have,
it to us?
I might have. No, that's a golden idea. Uh, so going back to, I guess, continuing with the idea of pacemakers. So obviously, you do your TEDx talk um, with your in DeSoto. Then you go ahead and create pacemakers. We've already established, what the goal of pacemakers is. But if somebody, goes to the website, which I'll include in the show notes as well. If somebody, wants to participate in the pacemakers, how do they get involved? How do they register? Where do they go? What's their next step?
So, as you mentioned, the pacemaker's goal is to help decrease health disparities by education, community building, and advocacy. What that looks like is number one, the easier thing to go through is education. So, what we're talking about, creating videos that are speaking in plain language to explain what's going on. I know everyone loves the TikToks and the Instagrams. I have some of those where you're explaining, like, this is what this word actually means. Like, why are you saying onychomycosis? Why you can't just say toenail fungus? Like, tell me how to treat it.
Yeah,
So, reaching people where they are and explaining what is going on through the system, having things like the vocabulary and what it means, having other things that we may not discuss as openly as is how hard it is to navigate the healthcare system. I'm going to get a little personal because I told you
sure.
my family has impacted different things. But recently, my 30-year-old cousin, who does not smoke, was diagnosed with stage 4 lung cancer.
Oh my goodness. Sorry
So,
to hear that.
thank you. So, when she went to a hospital in DC,
Mhm.
after going to several hospitals and them saying, oh, you have bronchitis, you got pneumonia, all of that kind of stuff, they eventually did the biopsy, was diagnosed with lung cancer. And because she had Medicaid for Maryland, they said they could not serve her or find her any help. Either change your insurance to DC or go find something in Maryland. And they didn't
Man,
connect or coordinate it. They're just like, you have cancer, go figure it out,
that's
which was
terrible.
terrible. So thankfully, she called me, and I was able to call around and go on the Facebook groups.
Yep.
And
Telling you.
I went on another doctor Facebook group, and I was like, yo, how can we get her in? So we were able to get her in within a week with Johns Hopkins. And
Wow. Great one.
they've been phenomenal, but there's so much more. Like when you're in and out of the hospital, she's in the hospital now, where you're kind of trying to navigate certain things, and you have to have someone to advocate for you. Like she was being discharged last week from the hospital without a follow-up, without medications, all of those
Really?
things. And they let her go home. She declined. And then they called yesterday, and she was in the waiting room for 5 hours when she's short of.
Man.
And when I asked to speak to the person at the desk to say, like, hey, can we speak to the patient advocate or something? This is kind of not cool. And they were like, well, people are waiting 11 hours. And I'm like, well, this is a risk.
Oh, my goodness.
Patient manager and all of this stuff. So within that, she was in the back within 30 minutes. If I had not, would not have happened. And for me, that's unacceptable because everyone doesn't have a family member that they can call to advocate for them. So I want to empower patients to figure out how to navigate the system. When you feel as though there may be bias or things aren't going your way, did you know that there was a patient advocate you could call in the hospital? Did you know that when your insurance isn't going a certain way or this like that, how do you navigate that? And then on top of that, 80% of your health is impacted from outside of the healthcare system. It's only 20% of the healthcare system.
Really?
So it's things like you mentioned, like the economy, like finances, education access, how safe your neighborhood is, what kind of social and community cues and stuff you have. Like, are you in a food desert? All of those things.
So, I know what I've heard about that. I learned about those about 2 years ago.
Yeah, because like if you live in one part of the town, you may have a wonderful Whole Foods or a Wegmans or something like that. And then 5 miles away, you may have a corner store or something. So why are there these inequities? And they love to say the buzzword of the social determinants of health. So I use that, which are kind of those 5 realms that I just talked about. But what it really is like the political determinants of health. We hate to say that medicine is political, but it is.
Right.
Universal healthcare, like they demonized it, but who are the people who don't have it? So it's kind of very interesting to me because we talk about these pockets and things, but what's very important and which I think health tech organizations should really take a look at are zip code based interventions, because that's what is happening in these political pockets is what's affecting the community and their health. It's not because they don't feel like getting their blood pressure medicine. They might only have a corner store where they can get canned food, or they might have to choose other things. So how can we create these interventions throughout all of those realms of life to impact your health? So that part I'm bringing up is more of like the resource part of the Pace Makerz, and then the advocacy component, where how can we talk to our senators? What kinds of things are out there? How can we move for birth control? So we're kind of working on those 3 realms. And with that community building, where you mentioned how can people sign up? So I know you'll put something in the show notes.
Yep.
But for these types of things, I'm going to have resources like, if you can't afford your medicine, did you know about GoodRx? You can click this link and go here and get your medicines for cheaper at different pharmacies. Or if you're having trouble with your utilities, did you know there's this organization that can help you? So each week we will send out an alert of a new resource and educate you guys about it. And then building the community further, we have an app coming out in the next few months that will allow people to ask questions amongst yourselves. And like people don't talk about a lot of things. So women who may be going through menopause, like everything you think about when you hear menopause is probably hot flashes, but there's so many more conditions to menopause that people don't talk about or know that they have treatment for. So how can we build that community to, one, share the resources, talk amongst yourselves and learn like, oh, I went to this doctor, oh, this helped, and then move forward. And then we're going to also start having events, both virtual and live, where we can talk about community-based issues and health issues. So if we had a menopause forum or summit, We can have speakers like doctors and nurses, but also people who have lived experiences, have sponsors from things like medical tech devices to come in. Like there are med devices to help with migraines. Why can't we have a migraine summit? And things like that that kind of impact the community, but not only bringing stuff like resources, but going further.
Right. Wow. Well, first of all, there's a lot going on with Pace Makerz. So anyone that is interested, you have your orders, lots of things to do. And number one, I guess the other thing, Erkeda, is just about you and your passion for, I guess, healthcare innovation, health tech. It's very personal for you. And I think anybody, talking to you for more than 5 minutes, you can really get that it's personal. Another one of the personal things I think you've kind of been touching on a little bit, just like, hey, let me be personal. In a couple weeks, you're going to be going on tour in person. And I think, is it in person, virtual? I'm assuming it's in person only.
It's both.
It's a little bit of both. Okay.
In person. So I'm going on a speaking tour, the Glow Up Tour, where we're going to be talking about overcoming obstacles. And this is something that can relate to almost anybody, because we're all going to encounter obstacles, whether or not it's in our personal lives or our professional lives, or if you're a student, that in between. So I'm going to schools, organizations, and communities and talking through my personal story, sharing how I've overcome obstacles, and then a game plan as to how you can overcome obstacles and kind of have your glow up. And you got to come to the tour to hear what glow up actually stands for.
Okay.
But it's so exciting. It's kicking off, and I'm excited to partner with people who want to hear more about it and learn how to help themselves or their teams get through it.
Awesome. And again, just so everyone knows, just for a second time, the Glow Up Tour will focus on Erkeda's personal adversity playbook for turning obstacles into opportunities. And Erkeda, I will include the link in the show notes, but just so I'm clear, for anybody that wants to register or sign up, I believe it's www.glowup.com.
Yeah, it's www.theglowuptour.com. Just so you know, Glow does not have a W, it's silent.
Yep, it's just GLO, correct?
Yes.
Great. And that tour will be kicking off in early November, correct?
Yes.
Okay. November. So it's a couple weeks from now. So from this recording, at least, it's about 2 weeks away. So Erkeda, we've had a great conversation. Before we head out, is there anything that we didn't cover that you want to cover, or just any type of shout out moment, or just, general PSA that you want to give our viewers?
I really appreciate you inviting me to be on the show. It's been a wonderful conversation. For all of the listeners out there, I hope that something impacted you in terms of what I'm saying, whether or not it is to continue being a mentor for those in your community, continuing to advocate for health, because even if you're not going through any particular health situation, at some point in time in your life or your loved one's life, you're going to be impacted by the healthcare system. So we should make it a good one. So definitely look into the Pace Makerz and use the link so you can sign up to get the newsletter, even if you just want to have a few free coupons or different little tips. It's wonderful. And if you want to join that community, I definitely invite you. And if anyone wants to reach out to me and ask a question or anything like that, you can definitely reach out to me via email, Dr. Erkeda, DRERKEDA at drerkeda.com, or my Instagram at Dr. D Graham, DOCTOR, the letter D, GRAM. And I'll get back to you. It may not be the same day, but I'll definitely
get back. She's got a lot going on. Well said, number one. Thank you, Erkeda, for coming on the show. And thank you to everyone for watching. Until next time.